YouTube and share on social media in the next couple of days. This evening, we're joined by Attorney General Weiser, Boulder County District Attorney Dougherty, and State Representative Judy Amabile. And we're going to start tonight by having each of them briefly discuss some of the things they're working on, and then after that, we'll get right into your questions. So with that, Attorney General, could you get us underway?
So let me start with a book recommendation. We're in a library, after all. How many people here have read the book, The Body Keeps the Score? Raise your hand. I can't believe my dear friends here have not read it. I now know this for both of them. If you haven't read this book, I strongly recommend it. It's been on the bestsellers list for like 2 years for a really good reason. Because the book tells the story of trauma and how we as a society are coming to grips with recognizing the impact of trauma. When you think about your lives, your family members' lives, and you ask the question, have they suffered trauma? It will not be hard to say, oh wow, my girlfriend was raped. My son was preyed on and bullied mercilessly in high school. My daughter was in this terrible car accident, which was a hit and run, and was left there and barely was able to call 911, et cetera, et cetera, et cetera. So when you talk about the criminal justice system, it is almost like a story of different traumatic injuries and experiences that can happen to people. When you talk about war, by definition, traumatic experiences. And the book starts by talking about what happened to people who returned from Vietnam. At a time when the phrase post-traumatic stress disorder wasn't a phrase. And the answer that was given to people was suck it up. And what the book says is trauma lives in the body whether we deal with it or not. When young people are the victims of trauma, for example, domestic violence in the home, it's not like that can happen in ways that leave that young person unscathed. It is more like saying that person has been set up for behaviors, for life experiences that will be really difficult unless we find a way to recognize, identify, and help people who face trauma. What I am thinking very hard about, and I couldn't have two better partners than those around me, is how do we as a society become more trauma-informed in how we respond to major challenges of our day. One ray of hope that I take with me from my trip last week to the San Luis Valley is the relationships that exist between police departments and the public schools, where they have the ability to say, there was a domestic violence incident at Johnny's home yesterday or tonight. You might want to make sure you check in with him at school. What's the reverse of this story? The reverse is no one checks in with Johnny. He acts out at school having had this traumatic experience, and he's labeled a criminal. And Johnny is put into the criminal justice system, which often is poorly equipped to meet the needs of young people or those with any number of behavioral health challenges. And so as we look at our society and do what you might call a trauma-informed inventory, starting in the criminal justice system, but it's got to be much broader, the question that I'm going to keep asking is, how are we doing? And how do we do better? And to answer that question effectively, we need leaders like District Attorney Michael Dougherty, like State Representative Judy Amabile, who both live every day with this question in their mind, and that's why I'm so excited to be here. What's your next?
Yes, go right ahead.
Good afternoon. My name is Michael Dougherty. I'm the District Attorney, and I am very excited to be with you this evening. Colorado ranks in the bottom 10 in substance abuse treatment being available in the community. Colorado ranks in the bottom 10 in mental health treatment being available in the community. You're here because you know that, you live that, and you feel that in your lives. Either because you have individuals who suffer, can't get the consistent high level of treatment that they need, or you live in communities where these issues are impacting community safety and well-being. And as a state, and as a county, we've made progress, but there is more work to do. I'm excited to be with you tonight to talk about the work that we have underway and what our hopes are going forward. And I really want to thank Representative Amabile and her staff for bringing us all together tonight. Can you join me in giving them a round of applause? And Attorney General Weiser, who often comes to Boulder and has a strong connection to Boulder, but does have authority over the entire state of Colorado. Thank you so much for being here tonight. I greatly appreciate it. So we continue to see these complex issues stemming from behavioral health problems that far too often go untreated or undertreated, impacting the lives of people in our homes and in our communities, in Boulder and throughout the state of Colorado. And when those issues occur in one's life, often it's not just impacting them, but also their loved ones. And there are times where those issues then cause them to flow into the justice system. And time again, we see so many cases in our office where we handle cases ranging from shoplifting, trespass, up to sex assault and homicide, where mental health issues and substance abuse issues are at the core of that person coming into the justice system. So we have to find a better way. We have to do more for the individuals who are being impacted, but also for the community safety and well-being. So for each one of the reforms, each one of those positive steps we've taken, we always have to ensure not only we improve the lives of the individuals, but also community safety and well-being. We have to enhance that and not make improvements that sacrifice them. And I know that my two friends and colleagues up here feel the same way. And I feel really fortunate because these are efforts that have to be maintained not just at the local level, but at the state level. And here at the local level, we continue to have mental health and drug diversion programs that I'm looking forward to talking to you about tonight that have been incredibly successful. But also local law enforcement, having co-responder programs where mental health professionals are responding with police officers. Like in Longmont, we have Longmont Police Chief Jeff Satter here. He's been a champion for these efforts because of the impact and the compassion that he has for individuals in the community, but also seeing that we have improved public safety when those programs work and work well. I will say that when we talk about what we're working on currently, I'll hit on two things before I turn it over to our representative. First, very excited because this past Friday we broke ground on the alternative sentencing facility here in Boulder County. It's an incredibly innovative facility, and it will allow us to do a lot to help individuals who are in custody at the Boulder County Jail. That jail was built many years ago for a smaller Boulder County and a smaller jail population. It was built for a population of 275, and now on a daily basis, it's asked to house up to 500 people. So the alternative sentencing facility is going to offer more programs and more treatment options for those who are going through the custody process. And Monica Rottner from Community Justice Services and former Sheriff Joe Pelly and a host of other people and agencies helped make that groundbreaking on Friday a reality. The other part of that that we're really excited about is we'll take the halfway houses that we have in Boulder County, community corrections programs in Boulder County, that are currently being operated below standard by for-profit corporations. We'll remove them from the for-profit corporations and have them within the county. And profit should have no role in the justice system. And then just this morning, I met with our newest member of our mental health diversion team in our office. It's been an incredibly successful program where we're connecting people to the treatment providers in Boulder County who are being arrested on low-level offenses. And I'll tell you more about that program as well. But very excited to be with you tonight. I'll turn it over to our host, Representative Amabile.
Thank you. And I am just blown away that I never would have thought I'd be sitting up here at a table like this with these two superstars. And it has been an honor just of my life to be able to do this work. My name is Judy Amabile, and I represent House District 49, which is the western part of Boulder, western Boulder County, Gilpin, Clear Creek, and western Larimer County. And, I started down this road with a mission to get at our mental health care system that I have experienced now for the last 10 years here in Boulder or longer, because I have a son who has schizoaffective disorder. and he has never been able to get the care that he needs. And he's been homeless on our streets. He uses drugs. He's been in our criminal justice system. And we haven't ever really been able to get, this is what you need in this moment, and now you can have that. And I know that this is the case for so many people. And the question, what are you working on? Like, I had a long list of things that I was going to work on this interim. And every day I start out wanting to get to that list. But what happens is I get an email from somebody, hey, my child had this horrible thing happen, or this horrible thing is happening to our whole family. Can you help us? Is there anything you can do? And I take that, I own that. I want to make that better for those people. I want to be able to say, yes, I have the answer. But I don't have the answer, because the answer right now doesn't exist. It doesn't exist in Boulder, it doesn't exist in Denver, it doesn't exist in Colorado Springs or anywhere in our state. And I think we've made some strides. I think I personally have made some strides, but it hasn't been enough. And there's so much more for us to do. And when you talk about trauma, this week I got caught up in the story that I think many of you have read about a young kid, a 13-year-old boy, whose parent dropped him off at Longmont United Hospital at the ER and left and never came back. And that kid has been there now for 6 weeks. And we have no idea what happened before that day. But based on all the conversations I've had with parents around our state, my hunch is that they were trying to get help. And maybe they've been trying for years or months. I don't know. I have no idea. But that's my guess. And finally, left with no other options, that's what they did. But now we have a 13-year-old who has just suffered, and he's in the middle of an incredibly traumatic event. He got dropped off at a hospital by his parent, and they never came back. And then he's sitting there, he's still there 6 weeks later, and no one is helping him. No one is making sure that he's okay. And that's an incredible failure of our system, and it's also not unique. It's happening. And so those are the kinds of things that our office hears about because people know I care. And that's a lot of the effort that I am working on. I'm working on making sure people do better in jail and that we have good standard operating procedures in jail so that people and staff aren't traumatized by their experience in jail. I'm working on making sure people can get off the street and into care, and making sure that we're somehow keeping people from falling into the criminal justice system to begin with. Because once they're in it, the trauma's already happened to them and to the victims and to their families, and that's where we really need to focus so much of our effort. So I know I'm not that cheerful. Anyway, I do want to just say that we have some electeds here. We have our mayor, Aaron Brockett, and City Council member Tara Weiner, and we have Erica Blum from Joe Negus's office. We have former state rep Jonathan Singer, who has also been a huge champion of these issues, and we have former school board president Tina Marcus.
Let me add one more point, because your leadership, Judy, exemplifies it. We need to better address the stigma around mental health. We need to understand that mental health care is health care, and that when someone is struggling with anxiety, or the phrase you said is
Schizoaffective disorder.
schizoaffective disorder. That's a condition, just like cancer is a condition. I can remember, many people here probably as well, the movie Terms of Endearment. People may remember that Deborah Winger character at one point said, you can tell people it's okay to talk about the cancer. Because back around 1980, having cancer was actually a stigma. People were afraid, they were ashamed, they were afraid to say it. Now people say cancer stuff sucks, but they won't say depression sucks. They're afraid to say it. This is going to take us being honest about how many people are struggling with their mental health and getting past a stigma that often leads people to suffer quietly. And is part of why we have, and I'll come back to this, a teen mental health crisis right now in this country. When we were growing up, all three of us, if you were a young person, the number one cause of death, people know the answer? Car accidents. This is before Mothers Against Drunk Driving, against a lot of work about automobile safety. Now, depending where you are, the top two are either poisoning or overdose deaths or gun violence, more generally suicide and homicide. Those are the two public health challenges that we need to bring the same mindset that we brought around automobile safety to. How do we reduce gun violence deaths? How do we reduce poisoning and overdose deaths? And in both cases, people die by suicide with a firearm or people who die with substance. There's something that happened before that is driving those really tragic losses.
Okay, thank you, panel. Now we're going to move on to the Q&A portion. We received many questions submitted through our RSVP link, so thank you for everybody that sent those in. We got a lot of similar questions, so we did our best to sort of combine those to make the most of our time. But if people here have a question, we've got some note cards, and we can bring one of those to you and then pick them up and add those to our list. So just raise your hands. We've got some people out in the audience that can bring you a card if you want to ask a couple questions. I've got this here, Christian, if you want. Thank you. And then if you're watching the live stream and you want to submit a question, please put it in the comments. We are monitoring those, and we'll do our best to answer all of those. So, and panelists, we'll leave this up to you as to who answers the question. Oh, finally, one other note. If you send us a question about a very individualized situation, please know we're going to follow up with you from the most appropriate office. We'll get back to you this week with answers to those. Okay, moving right along. Our first question is about teen mental health. The question is, we seem to have an epidemic of teen mental health problems. What are the factors creating these problems, and what can the state do?
I'll start. You can follow. Picking up what Representative Amabile already picked up. We need to better articulate and implement a better mental health care system that is robust enough to meet the needs. That work has to be integrated with law enforcement. Maybe we'll talk about diversion programs, particularly for young people. It has to be integrated with the educational system. And a good shout out to the chief, I just heard about your student resource officer program and how highly regarded those officers are in the St. Vrain School District, and how much you put into training in a trauma-informed way that builds authentic relationships. Because the ability for a young person to have a relationship with another student or an adult where they can say when they're not feeling okay, back to my earlier tragic endpoint, you can imagine earlier points where I'm struggling now, I'm thinking I'm going to take a pill, or I'm struggling now, I'm thinking about how to get a weapon. If you have a trusted adult, could be a parent, could be a counselor, could be an SRO, and they're able to know how to support somebody. And there are a range of programs. I was actually in St. Vrain today. They have a program where they take young people who are in that moment of struggle, and they bring them to horse therapy once a week. And the magic of animals as therapy for young people is really powerful, and they've had extraordinary results. So one answer, why is this happening? Because we are living in a time of disconnection. Those relationships, when they work and when people are supported, it's like an elixir for someone. It makes a whole game changer. The absence of relationships, the absence of connection, are filled by other things. Social media platforms whose algorithms are designed often to engage someone, quote unquote, even when it means taking them down a dark hole. If you're a young girl looking on Instagram around body image, you will get content around self-harm and suicide. The other availability of substances, whether it's vaping, whether it's, I mentioned fentanyl, is unfortunately a big risk factor because they are highly addictive. I know someone in Boulder County whose child was addicted to vaping. And the problem in a young person is you can't actually get the cessation because you're not supposed to be having tobacco. But these companies like Juul use social media to market young people to get them hooked. So we sued Juul. We're bringing back $32 million to address this crisis. We also sued a bunch of opioid manufacturer distributors to get $720 million to address that crisis. And young people are core because if we can stop them from going down this road, help them recover, the difference we're going to make in their lives is considerable. So there are a lot of factors going on. I've only talked about two. There are a lot of responses. I talked about a few of them. I know this is something you're deeply passionate about. What would you add?
Well, okay, I think that's a great summary, and I think there's obviously a lot of things that are contributing to this crisis that we have. But also, what are we doing in response? Because the response, notwithstanding some individual great programs, but we have to have a full continuum of responses because for one kid, some kind of a therapeutic intervention might be great. But for another kid, that isn't going to be enough. And so we have to build out a continuum of care. And I know it's kind of unpopular to say, but some kids and adults need hospitalization. They need that level of treatment, and we don't really have that. And so we need that. We need beds, we need hospital beds, we need residential treatment, we need step down, we need a full continuum, and then we need support for the family in the home for when this person doesn't need that level or has had that and is now back home. Ongoing support. If you have diabetes and you get diagnosed with that when you're a kid, you have diabetes care your whole life. They don't just wait until you go into a diabetic coma. And then every time they let you go and they don't give you any insulin and they don't tell you what to do, and then, 48 hours you're back. That's not what we do. So that's what we need to do for kids who have mental health disorders. We need to support them continuously.
I agree with the Attorney General and the Representative. I would add, from my perspective as District Attorney, when I think about teen mental health, I'll just hit on the following things. We have sex assaults amongst high school students. We have too much use of drugs, alcohol, and high-potency THC amongst high school students. We see so many kids struggling with these issues. They flow into the criminal justice system. That's why we established a juvenile diversion program in my office, where we now successfully divert more than 50% of all the kids out of the justice system as opposed to prosecuting them through the justice system. And that's exactly what we need to be doing there. But also recognizing school safety. And we all see the horror stories, and if you have kids who are loved ones in your family, you worry about it all the time. But even ones that maybe just fly across your radar in a given day. For example, Longmont was in pursuit of a guy who had stolen a car. And two of the school resource officers, two of the SROs, moved in to protect the school. That individual then shot at both the officers and hit both of their cars. They exercised tremendous courage, and they were able to apprehend him outside the school. He ended up, as a result of our prosecution team's efforts, receiving a sentence of 60 years in state prison, which is the right result. But I'd be remiss if I didn't recognize the impact on all the school children, the parents, everybody in that community. the school, and you saw this in the news for one day because it turned out to be a fake call. But you think about the impact on the kids and the educators and their mental health. And I really appreciate the work of the Attorney General's office and what we're doing at the state level to improve the laws around that. He's picking up his mic, so I have a sense he wants to talk about it. But those are the things impacting teen mental health. We're trying to build systems to account for that. We also need to build better systems in the schools and the communities to help our kids, because they have a bright, bright future. We just need to help them with these issues so they can get there.
Actually, I wanted to pick up something, and it was on my mind thinking about Eric Talley, but now, Chief, your officers are also part of a community of law enforcement who lives with trauma. So I mentioned this book, The Body Keeps the Score. In law enforcement for too long, the ethos had been, suck it up. It's not okay not to be okay. But that's not how trauma works. Unconsciously, it's still in your body, and there are people, law enforcement officers told me, who will drive out of the way to avoid going back to a scene where something traumatic happened, not even being conscious that they're doing it. And so how do we create a culture without stigma that law enforcement feels supported? And there's more emotional awareness, because effective law enforcement is enabled by emotional health and emotional awareness. So a couple examples. One is one of the worst officer-involved shootings in a department that I heard about happened because an officer showed up at a child abuse situation and witnessed the result of a child who was badly beaten. After that situation, he went right to another situation and then escalated that situation, used force inappropriately. He's no longer on the force. Which begs the question, did we serve that officer well? And one of the trauma-informed responses is, how do we train law enforcement so that they can support one another with emotional awareness, which can include, that was a pretty traumatic call, you better sit this next one out. Or noticing someone's getting a little more escalated, Sergeant Johnson needs to see you now, getting them out of the situation. There's a program we've introduced called Active Bystander in Law Enforcement to give law enforcement agencies tools to better help one another and not to allow people's emotional states to lead them into what can be career-threatening situations for them and can be tragedies for the community.
Okay, thank you. The next question was submitted through the RSVP. Property crimes went up dramatically during the pandemic. What factors caused these increases, and do we have any examples of positive trends?
I think there's a host of reasons that property crimes went up during the pandemic. I'm going to list the ones that come to mind. People under financial stress, people being cut off behavioral health treatment, people seeking to commit crimes to make profit or because they're part of crime rings, consequences not being enforced at the proper levels because of the limits of jail and the justice system. Put those things all in a pot, stir them around, we see property crimes go up throughout the United States. Nowhere higher than the state of Colorado, which is a tremendous concern. But when we talk about positive trends, we are seeing some positive trends. So, for example, I look at auto theft numbers as reflective of what I just described. So, auto theft in the state of Colorado, we were averaging roughly 22,000 cars stolen statewide, year after year after year. Pandemic hits, that number goes up to above 40,000 cars being stolen statewide. Here in Boulder County, we were at 700 per year, 700, 700, 700. Pandemic year start, we go up to 1,100, 1,100. Statewide, we are now in a steep decline on auto thefts. Although I would recommend parking your car at TIA without thinking twice. Seriously. But other than that, around the state, auto thefts are on a steep decline. We're heading back in Boulder County to a year of somewhere between 700 and 800. When I looked at the numbers the other day, statewide, the numbers are around 16,000. We're not going to come anywhere near that 40,000 that we've experienced. There's a number of reasons for that. I think law enforcement has more tools and support to do the work they need to do. We've raised community awareness about leaving cars unlocked, which so often that was the way people were getting into the cars. And also the criminal justice system has come back online. And an auto theft law just got passed that reflects the serious nature and the serious response we need in dealing with it. So property crimes have been a significant issue, and our work is not positive signs in terms of the changes in the law and also the data.
Let me add something, picking up the law enforcement conversation. During the pandemic, like teachers, like nurses, law enforcement officers took it on the chin. It was really hard. And a lot of law enforcement officers were like, I'm done. We've heard the same dynamic with teachers, nurses, some other professions. Frontline workers had it awful. And here's the sad truth in many parts of our state. A lot of agencies are down in the numbers of officers, and they're then doing something which, when you're on the other end of this, it's pretty awful, which is, I'm sorry, sir, I know your car was stolen. I know you've got a videotape of it. We just don't have the people power to investigate it because we're really thinly staffed. That's problematic because to the extent that word gets out, that the police department is not going after those stealing cars, it's not like criminals don't get that word. So part of when your DA says get the criminal justice system back online, part of that includes staffing up to have the law enforcement to do the investigative work to go after and hold accountable people who are stealing cars. And I worked with the legislature and support with your DA and others to get money to help recruit more people into law enforcement. Because we have a shortage right now that is driving part of this dynamic, and we need good people becoming law enforcement officers. That's something I'm excited to continue to work on because it matters. What type of law enforcement we have will keep us safer, will be more trauma informed, and will help address these opportunistic crimes. One more small thing from our office. We're building up to respond to this organized crime rings, retail theft and catalytic converter theft, because we know that it's the profit motive in some cases. People think they can just steal it, get away with it, resell it. There's now a new law that these online platforms like Amazon Marketplace or Facebook Marketplace, they can't just sell it from anonymous accounts, which is how a lot of this traffic goods. And Jeff Reeser from our offices here, he's worked really hard on that issue as well. Like Michael said, we've got a lot of work to do on this front.
Can I add one thing? Because the Attorney General is absolutely right. And one of the questions I always focus on when it comes to auto thefts is what is the arrest clearance rate? In other words, when you hear how many cars have been stolen, before you ask about what bonds are being set or what sentences are being handed down, for those things to work, for the criminal justice system to work, law enforcement has to arrest the person who stole the car. So in Aurora and Denver, during the pandemic, their arrest clearance rate hovered between 4% and 9%.
Which means you have to pick this up. Which means 91 to 96% of victims of car theft were told, sorry buddy, we can't help you.
And in one case, actually my buddy was told, just fill out the form online and submit it. And he said, I have a video of the person going in the parking garage. We don't come out on these, just submit the form. This was in Denver, to be clear, not Boulder. So 4% to 9%. So when you think about what bonds are being set, what sentences are being handed down, those are legitimate questions to ask. But first you ask, what's the arrest clearance rate? Because if 91% are getting away with it, and not being held accountable, and not being brought to justice, we can't do anything to help those victims or drive that rate of reoffense down. Here in Boulder County, thanks to the outstanding law enforcement we have, our rate tends to be about a 25% filing rate for auto thefts, and it's going back up as we look at the data. So they're doing tremendous work, and that's an important part of it as we look at all these things in the mix.
Okay, thanks. Just real quick, Tom, can you give me a time check?
6:09.
Okay. We're gonna keep it moving. How can family members assist in helping their loved ones with serious mental illness and substance use disorders when they refuse treatment or are not aware of their illness?
Okay, I think that's me. So it's actually really hard. And as a family member who has been trying to assist somebody, there is schizophrenia, there is bipolar with psychotic episodes, and there is something else called anosognosia. And that is something that 50% of the people who have schizophrenia or bipolar with psychotic episodes also have. And it means that you don't have insight into your disease. So you don't know that you're sick. You don't know that the voices you're hearing are voices. You think that's happening. And you don't know that you need help. And there's a great book called I'm Not Crazy, I Don't Need Help, and it's about this subject. So it really does make it very hard for people to advocate for their person. And then we have a system that really pushes you away. So a couple of things that I'm working on. One is we need more pathways to involuntary treatment. And again, I know that's controversial, but I absolutely think that that's one of the things that is necessary for us to get people the care that they need. So last year we ran a bill that is a study that is looking at the care courts in California and some other states and saying, how can we mirror that, or how can we implement that here in Colorado? What would it take? What would the law changes be? What facilities do we need so that when we have somebody who we deemed a danger to themselves and not able to take care of themselves, and we've gotten them into involuntary care, where is that care? And who pays for that care? And I'm going to California in a couple of weeks to look at these care courts with the person who runs the Office of Civil and Forensic Mental Health and a bunch of other people. And hopefully next year we'll look at how to fund that. And that might be a statewide ballot measure, or it might be some other way. But so that's one thing. And then on a more granular level, families are pushed away routinely by the system. So under the cover of HIPAA, the Healthcare Privacy Act, you're told, nope, you cannot have any information, you can't do anything for your person. And yet, miraculously, when they need you to engage, when your person's at a hospital and they're getting released, and they're down in Colorado Springs, because that was the nearest place, they call you and they say, yeah, come get them. But they don't give you any other information. So HIPAA is a federal law. I'm not working on changing that law, but I am working on some legislation that would say you can implement, you can use HIPAA in the way that it is written, but you can't go past that. You can't do more than is required by the federal law. And all of these mental health care providers are, not all, but many of them are going way beyond what is required. And we're going to ask them to stop doing that. And I think that will be very meaningful, because people can't get better if they don't have the support of their family. It's really hard. And that is a big part of the problem. I'm part of a group of parents of adult children with serious mental illness, and every single one of us has this same difficulty. And you get your person to sign a release when they're doing well, and every time you go to use the release, so you want to get information, they tell you, oh, that's expired. There's no consistency in how long they last. They don't let you know ahead of time that the form is about to expire. They don't give the patient the opportunity to re-sign the form. They don't tell them either. And all of those things, I think, are important to change.
So Jeff's taking notes to work with you on that.
Thank you.
You really, she's a hero. I just would say part of what we need is the people who've gone through the experience to tell their stories, and for public policy makers to listen hard. I can't imagine the pain that you and other people in this group live with. We should not be making it harder.
Okay, another question that was submitted. How do we decouple mental health and healthcare from the prison industrial complex? The Department of Corrections budget went over $1 billion this year to create more prison capacity. Is there a better solution? And if so, what would that look like?
Well, let me start by underlining something your DA said, because I think the question has a premise that I want to start with and then answer the rest. The premise is, are there people who are getting rich and making money off of others' misery and have a vested interest in keeping people incarcerated in the criminal justice system? And what your DA said is, that's morally wrong. We have to stop that and end that. And it sounds like in Boulder County, you've now got some concrete progress you're able to do. To the extent there are people who are making money and driving up these prison budgets, shame on us for our failure to get to the other side of what is a moral imperative. The criminal justice system should never be driven by the profit motive. Now, next question. People are incarcerated for car theft, sexual assault, and I visited the Denver Women's Prison recently, and I got to hear about the state of our mental health care for people in prison. To say that we need to do better would be a gross understatement. The limited amount of mental health care available to people who are incarcerated, that's also on Jeff's list. We've got to be doing better, because if we care about people leaving prison and not when they're back in prison, we need to do a lot better thinking about their behavioral health care needs. I'm proud that some of the money we got from this opioid settlement is going to provide medication-assisted treatment in our prisons and helping people have a warm handoff so they can stay in treatment and not go back to using. That's a start, but there's so much more we have to do. And thanks to a model in Boulder, there's also the chance to divert people so that where you need behavioral health, they're actually getting it. They're not in prison not getting it. Can we go next?
So I appreciate that question. If you look at the Department of Corrections report for last year, 42% of all the people in prison have a significant mental health disorder. Right now, in Boulder County Jail, over half of the jail population has a significant mental health disorder. 72% of the state prison population have significant substance abuse disorders. 76% of the parole population have significant substance abuse disorders. And mental health is entwined in so many of the issues that people are struggling with in the state prison system. We have to pull that apart by eliminating for-profit private prisons, but also ensuring that the prison system is designed to help people successfully rehabilitate. We all have a vested interest in that, all of us, because people are coming back to our communities. Unless they're sentenced for murder, which results in life without the possibility of parole, they are coming back. And in Colorado, they come back and they fail, time and time and time again. We rank in the bottom 10, the 10 worst in the nation, in successful rehabilitation of people coming out of state prison. Statewide, 45% of all the people, so picture 10 people walking out of the facility this morning. 5 are going to be back within 3 years. It's 45%. The nationwide average is 32%. So think about how much better we could be doing if we were just average. And Colorado is better than average in everything else. So when you think about that rate, when I think about it, I call it a failure rate. We cannot accept that in the state prison system. If I told you to go to Full Cycle, run by Russell Chan, who's here, and only half the bikes have the wheels fall off after you leave, you probably wouldn't go there. How do we accept
That's not true, by the way,
No.
I don't have the data for Full Cycle, but I'm going to trust that's not true. But if I told you the Attorney General's taking all of us to dinner after this, but only half of you will get food poisoning, you would not do it. We should never accept a 50% failure rate from the Department of Corrections. Now, under Governor Polis, there's been a renewed energy and focus on improving that. We have systems in place, and we've seen the data trending just slightly in the right direction. I don't want to exaggerate it. We have a lot of work to do, but people get out of state prison over and over and over again when they're supposed to, and they reoffend, which is not what's supposed to happen. And when I say it, I'm not being Pollyannish. I'm just looking at other states and the nationwide average and saying we can and have to do that.
So I'll just add, one of the committees that I'm on during the interim is looking at recidivism. And it is, first of all, we don't even know what it is. So yes, we have about a 50% recidivism rate, but every organization, everybody who does this work has a different definition of what recidivism is. So we're funding programs that are claiming, oh, well, if the person does our program, we only have a 5% recidivism rate or a 10% or whatever they're claiming. But everybody's using a slightly different definition of that. So we're going to try to get at what is that definition, and then we're going to try to standardize that so that we have a way of measuring how well our programs are actually doing. And then we're going to look at legislation that says, what are the ways? Can we get a group of experts together to actually talk about what is effective in reducing recidivism? What are the 10 top evidence-based ideas out there? And then I'll just add that anecdotally, because we don't have the data yet, but one of the things that really hurts people is they leave prison and they don't have anything. They don't have any money. When you leave prison, they give you $100. In 1970, they gave you $100. And now, in 2023, they give you $100. And that isn't meaningful in any way for anybody. So we're looking at ways to help people actually earn money, real money, actual money, pay for actual services that they can provide, so that when they leave prison, they actually do have some money, and they have some skills, and they have some training, and they have some on-the-job experience. And that's one of the things that we're working on for this session coming up. And also just globally, if we could address somebody's mental illness before they ever committed a crime, then we wouldn't have 50% of the people who are incarcerated with a serious mental illness. And then I just want to say one more thing, which is last year we ran a bill. It's about how we're treating people when they're in DOC. And what we found, disability law went into DOC and documented that people with serious mental illness are being strapped to beds and put on 4-point restraints. So you are literally chained on your back on a bed. And there was one person who spent 39 days on a 4-point restraint bed. That's solitary confinement, and it's torture. And that person, when he leaves DOC, is not going to be doing fine. He has experienced a massive amount of trauma. And they do, just to be clear, they do let you up to use the bathroom, to eat food, but then they put this person back on the bed. And at the state hospital, they use that a 4-point restraint also, but the maximum is 4 hours. And they use soft restraints, they don't use chains. And it's a useful tool. And we didn't say, hey, you can't do that at all. But you can't do something so dramatically different in the prison than you're able to do if somebody is in the state hospital. And so that kind of thing we also have to just keep working on.
I was going to say, one goal I had tonight was to have a couple of issues to work with Judy, you on. We've now got 2 for Jeff. One is the recidivism effort, which we're very concerned and focused on. We did a report about it, looking at some options. And then also the parents of mental health is another important one. So before we leave tonight, let's see if we can find the third one.
Okay, this is a good question from the audience because it was also asked by about 4 people on the thread. So I'm concerned about the lack of healthcare parity. Last year we purchased health insurance on Connect for Health Colorado. We discovered that the copay for mental health appointments was $100, while the copay for a general practitioner appointment was $25. Why is this discrimination allowed by the state?
Whoever asked the question, can you make sure to talk to Jeff as your hand afterwards? We have both federal and state law requiring parity between physical health care and mental health care. We're looking to have it better enforce this principle. I don't know why this is allowed. We need to do all we can to enable access to mental health care. This discrimination is the opposite of that. We've got to get better as a society to recognize the need to provide mental health care, and this parity law is there for a reason. So I don't know the answer. If someone can get those tips to Jeff, we can look into it.
I'll just say, I think the parity problem is systemic, actually. It isn't just a copay is higher, or they're trying to limit the number of visits you can have. It's really systemic, and at every turn, it isn't as good. The care you can get isn't as good as physical health care. And I think we particularly have a problem with the Medicaid reimbursements. And I have a constituent who I don't think is here tonight. Andrew, are you here? No. Okay. So he's an independent provider, and what he gets reimbursed is dramatically less than what a provider who's getting paid by an insurance company would get reimbursed, because he's taking Medicaid patients. And we have hundreds of thousands of people in our state who are on Medicaid. We're about to have a whole bunch less, but right now, and they can't access the services they need, because it's the whole way the system is set up, where we have the Medicaid dollars coming into the state, and then we have for-profit entities that are administering those dollars and contracting with community mental health centers and independent providers, and they get a certain amount of money every year. And if they spend more than that, this for-profit entity in the middle of all of this, they lose money. And if they spend less than they're given, they make more money. And something in that system, I would say, appears to be dramatically broken, especially on the mental health care side.
Okay, thank you. Another question. What steps has Colorado taken to increase treatment resources for people with substance misuse disorder? And relatedly, what is happening in terms of a facility for detox in Boulder?
I will let Michael answer the second part of the question. I'll answer the first part. We sued, and we're still looking for more targets, those who were involved in this terrible, uniquely American story. You go to Europe, ask them, what's your opioid epidemic? They'll be like, what are you talking about? The United States of America, because of the profit motive in our healthcare system, because of Purdue Pharma, because of McKinsey and Company, because of Johnson & Johnson, pushed pills to millions of Americans and got people addicted. The pill mills, you heard about some of this, where people were writing these prescriptions for everybody and anybody. In the San Luis Valley last week, there were pharmacies giving out more pills than there were people in that region. All that access to addictive medicine had a toll, and it created an opportunity for cartels in Mexico to say, hey, let's provide heroin, which will be cheaper and more accessible than trying to get pills on the street. That was the second wave. We're now in the third wave. It's fentanyl, which is synthetic and 50 times more potent than heroin. The same cartels are pushing it, and they're pushing it to other drugs. And here's the painful reality. If you don't get treatment and recover, the chances are good you're going to die. Because the potent fentanyl out there is like playing Russian roulette every time you're using drugs. So the absence of treatment facilities means that, and this is not a hypothetical statement, it is a 100% true statement. There are people dying today on wait lists to get treatment for substance abuse disorder. We do not have access to beds and inpatient treatment for everyone who needs it. We do not have enough recovery facilities, including like sober living, so that people can stay clean. So the $720 million, unfortunately, is not going to fill that entire gap. It's being managed by local collaborators. There's an effort here in Boulder. You should talk to your elected officials. I'm not sure who among you is looped in, but each local community has to decide how can we build more capacity, because every community in Colorado needs it, and it's about saving lives. So detox in Boulder, any updates?
So a couple things. First, I will say that we need to do much more. It is an epidemic that is hurting so many people and killing far too many people, statewide and nationwide. Thousands of people are dying, particularly because of the prevalence of fentanyl. So last year we had a fentanyl bill, which a lot of the discussion around the fentanyl bill became whether it should be a felony or a misdemeanor for possession. And that became a lightning rod issue that actually distracted from the fact that it was the first bill in far too long that dedicated money for treatment. So there are $29 million in that bill now available in the state of Colorado to help individuals in jails, but also in the community. Because quite frankly, people shouldn't have to hit the doors of the jail to get the treatment they need. They shouldn't have to be prosecuted by my office to get treatment. We can build these programs in the courthouse and the jail, we do, but there are people suffering and dying in our communities. Ken Kuffner, our first assistant DA, and Connor Booth, first assistant DA in the back, we get notified anytime someone dies of a drug-related death in Boulder County. I'm not exaggerating when I say our phones are ringing or we're getting a text at least once a week in Boulder County. Longmont PD, I can put Chief Satter on the spot, but I don't want to ask him if he doesn't know the answer. Not only are people dying, but how many people are being saved by law enforcement because of naloxone. So a couple years ago, Longmont PD saved 34 people who certainly would have died but for the police being there. I don't know if you know the number for last year, Jeff.
We're at 20 this year.
20 this year that they've saved because of the prevalence of naloxone, which is also known as Narcan. If I say Narcan, Trina gets upset at me that I don't call it by the generic name of naloxone. But Trina and the Substance Abuse Advisory Group we have in Boulder and the fentanyl work group we have are doing so much, particularly with the new funding coming in, to make sure that we're providing treatment. Detox facility in Boulder, we have a number of beds. It's far too small a number in Boulder County. It's out by the jail that are available for individuals who have to go through detox. That system, that structure, the number of beds there needs to be greatly improved and built upon. Here in Boulder, we are regarded as a leader in what we're doing around substance use disorders. And we just had this meeting this morning where we talked about what we're doing in terms of raising awareness, raising access to naloxone, helping people connect with treatment, and what's going on in the legislature. But we need to be doing far more and helping other areas of the state, particularly the rural areas that are suffering financially and have an epidemic of deaths related to fentanyl, to address this problem head on.
Jeff, of those people that you give naloxone to revive, how often is the same person getting revived again?
We had a couple. It's not as common. We check in with them with our core lead people also to find, that's great.
CORE is their co-responder program. Lead is law enforcement assisted diversion. So it's that kind of progressive thinking so that hopefully when someone encounters law enforcement and their life is saved, we're taking action, and that person in a literal near-death experience, I need help, and then there's a way to get them help. If they don't, back to my metaphor, Russian roulette, they either will get revived again or they will overdose. What is worth, again, underscoring is fentanyl is so powerful, the effect it has on people's brains. They're not thinking straight. If you can get clean time through detox, you're then in a position to say, I got to rebuild my life. And having the right forms of treatment and recovery and peer coaching, we just got to do a lot better.
So I'm just going to, because I'm sort of the Debbie Downer of the crowd, I guess.
Well, this is not exactly an uplifting topic that we're talking about today.
One of the things that is a systemic problem, so we at the legislature directed a lot of money into substance use disorder treatment. And we are doing that. But this year, the RAISE, the Regional Accountability Entities, these organizations that sit between the Medicaid, they get the Medicaid money and then they contract. They could not contract with anybody, with enough people to provide these substance use services. And they ended up having to return the money to healthcare policy and finance to the tune of about $90 million. So that's money that we said we want you to spend this on this, but they couldn't because they weren't offering a high enough reimbursement, or they couldn't find anybody who had the staff to do the work, or they couldn't find a location from which to do the work. So that's, again, this sort of systemic piece that's kind of broken that we really need to do some digging around, because that could have saved a lot of lives, but instead it's going to do something else. I don't know what. Nothing nefarious.
What gap is addressed by Boulder County's alternative sentencing facility? What kind of services will be offered there? And since the facility is still a year or more out, what is being done in the meantime?
So the alternative sentencing facility, we broke ground this past Friday. There was a ceremony and celebration for that, and it should be up and running within 18 months. So it'll be an entire new building and structure with community justice services and Monica Rocker's team playing a leading role and having it individuals who would otherwise be staying in one of those halfway houses there, but also offering more substance use treatment and mental health treatment, and helping individuals who are either day reporting, having to check in at the jail, or work release, who go out during the day and work, coming back in and not being put back in the general population of the jail. It's important to stress that we had 434 people in the jail the other day. It's roughly the number right now. 223 of them have significant mental health disorders. And when someone goes to jail, the longest sentence they can receive is 1 year. So they're coming back to our community if they're being sentenced on a misdemeanor. So ensuring that they have mental health treatment, and the alternative sentencing facility will allow for more of that, is really a key part of why that is so critically important. Also, I would highlight for you an issue that we have, which is with the state hospital that impacts Boulder County Jail as well. So the state hospital is operated in Pueblo. Individuals who are either found or being evaluated for competency are sent to the state hospital. Here's why that matters. Because the state hospital, due to a lack of staffing and resources, is a broken system currently. The wait list for the state hospital statewide is 460 people, 52 in the Boulder County Jail. So right now, as I say this, there are 52 people in the Boulder County Jail who are ordered by a judge to be transported to the state hospital for care, evaluation, and a restoration of competency so their case could move forward. So they could go before court, and victims could have justice, and the community could have some resolution or closure on the case. There are also, the reason this matters to all of us here, is that those 52 beds have been taken up for this entire time. So when you think about the maximum population of the jail and the downstream impact on community safety, that's flowing directly from the broken system we have at the state hospital in Pueblo. We have 2 champions up here who are working on making it better. The 3 of us are very aligned on this. And I want to stress that this is not just my view of it from where I sit. A federal judge issued a decree ordering Colorado to comply with certain benchmarks in terms of care and evaluation. Each year, our money, taxpayer money, in the tune of $12 million is paid by the state of Colorado to come nowhere near meeting those standards that the federal judge set years ago. So it's not just a state hospital in Pueblo, it has a much closer to home impact. And that's why we have to continue working on these issues. And the alternative sentencing facility will allow for those individuals and individuals within the jail to have more space and more treatment options. It really is such an exciting and innovative step for Boulder County. So I feel like a lot of these questions get Judy to sound like Debbie Downer, but the alternative sentencing facility is going to be a tremendous improvement for the individuals who are in custody and also for community safety.
Well, let me also try to put a little light into this darkness, which is we need a call to service for law enforcement of the kind we're hearing about in Longmont and for behavioral health professionals. Part of the reason that money didn't get spent is there is a major pipeline problem. The pandemic made this worse. So you make the needs for mental health care greater and you reduce the supply of it at the same time. That is a terrible equation. The only way we're going to turn it around is by building a pipeline for mental health and behavioral professionals. For example, on substance abuse, Suboxone is now easier than ever to give to people, to help people live their lives in ways that they're not thinking, where am I going to get my next hit of fentanyl from, and to rebuild their lives. But if you don't build the capacity to provide health care, then people are going to be struggling. They're going to be struggling with their addiction and often turning to different crimes to feed the addiction. And so there's a need for action. I love your vigilance, and we're going to stay in it with you.
Okay. All right, I'm combining a question. We got some remarks from somebody in the audience who's worked in the field of healthcare for 27 years and has been exhausted in the last few years. And her question is around, well, I'm going to combine these. What funding is being made to provide more beds and pay staff appropriately in mental health hospitals and support people in the trenches so that people with mental health issues are given treatment instead of incarceration?
Okay, so good. They're all good questions. Last year we had a bunch of ARPA money to spend, and we directed about, I want to say it was about $80 million to do a few things to get our workforce going. So tuition reimbursement, signing bonuses, retention bonuses. We also gave everybody a raise. I think it was 6 or 8% state employees. At Pueblo, in order to attract people, they started out offering a $6,000 signing bonus for nurses. And they got I think they got one person. And then they upped it to $14,000, and they got 20 people. But they need 70. So part of the problem with the jail is that they can't get people to Pueblo. Pueblo has a whole wing of that hospital that's shut down right now because they can't staff it. And so it's a Gordian knot of things, but we are working on that. And we are also building beds. So also 2 years ago with the ARPA money, or last year with the ARPA money, we allocated $65 million to build step-down beds, and those beds are starting to come online now. And they're meant to be distributed throughout the state so that there'll be smaller facilities, and anybody who's coming out of the state hospital would be eligible to go to one of those places, and also somebody who's on the competency who otherwise would be bail eligible but needs competency restoration and has nowhere to go. We could stand up a facility where they could do that as an outpatient but have a place to live where that's also a therapeutic environment. So there's a bunch of different ways we're trying to get at that. But I will say that I think part of the problem, and I read this in the New York Times, but I see it also, our doctors and nurses are facing moral injury because they go to work every day and the caseloads are so high, especially for these ER doctors and ER nurses, that they can't, and there's so much pressure from this corporate hospital association and hospital ownership that they cannot spend the time that the patient needs for them to spend in order for them to do a good job of treating their patients. So they're part of this mill, and they're watching people suffer as a result. And that is demoralizing, and no one wants to work in that kind of an environment. And that also is, I think, a distinct and different problem that we also have to address.
Okay, thank you. Another combination of questions, this one about kids. If funding were available, how would you address our mental health gaps starting at an early age? And then also a question about kids in the courts. How do we make children who are victims, how do we make those processes more child-friendly in the courts?
I'm going to start on an adjacent point. In the 1990s, Robert Putnam wrote a book called Bowling Alone. That was a tale of declining social capital. I would like to see us investing in social capital and connection. So let me give you an example from the San Luis Valley where I was last week. Cindy Medina is the river keeper in the Alamosa River, and she's got a program that takes young people out to fish and also exposes them to reading. I'd like to see many more such programs that build connections between kids with adults doing things off their screens. Part of why we have the mental health challenges we have is those connections don't exist. Those habits of being together with peers, being in the outdoors, reading, don't exist. So as we think about the mental health challenges, I'd like us to not only start in the very important place you just talked about, which is we're closing down our state hospital wing while people are in Boulder County Jail on wait lists. That is a terrible equation, and we need the vigilance that Judy brings to that work. And if you go further upstream, we have a connection crisis. It's often said the opposite of addiction is not sobriety, it's connection. So I would address the connection crisis as part of how we address our mental health crisis.
Okay, great. We received several questions about serious problems in the family court system. What actions are underway to make that system better?
That's you.
So
You had a prior question from the other one that was even more you that you didn't get answered yet.
so I'll answer that one.
And so it said, that's what politicians do, they answer the question that they're more able to answer.
Well, I'm going to combine a couple things, and I do want to answer the question. So family court is separate from criminal court, which is separate from civil, which is separate from municipal. Those are all different systems. So I've been in court over 1,000 times in my career, a number of times in municipal court, 0, a number of times in family court, personally or professionally, 0. So they're completely different systems. But I think the question goes to, what are we doing to help families who go through the court process? And that's a good question. Because cases often take too long, and they're incredibly difficult on everybody involved. So I don't have any experience in family court, but I have a ton of experience working with families who go through the court system. We in our office have victim advocates who are assigned to every case involving families that have been victimized. We also have a certified support dog who works directly with the kids who come into the court system. We worked hard to improve the child hearsay laws in terms of when children have to come to court, and instead when someone testifies to what the children told them, for example, a police officer or a detective, obviously there are protections in place for the accused, but we've expanded the child hearsay laws here in Colorado over the last few years with an eye towards how do we make the system work better for kids who have to go through it. So for example, the trial that I handled myself a couple years ago, a young girl, a stranger broke into the house and started to sexually assault the young girl in the house when her father heard. And the intruder fled. I feel like this is a Longmont Police promotional discussion tonight, but Longmont Police did a great job. We have a lot of outstanding law
If the
enforcement.
Boulder police who didn't come tonight really missed out.
But Longmont PD not only tracked the guy down, but built enough evidence for us to prosecute the case. And they did a great job, and that's why we were able to secure a conviction at trial. But the point of this really is the support we're able to give the family throughout. They, to this day, will suffer the trauma of that attack, and they'll never forget it. But making sure we do everything we can to support them every step of the way is what we in the system should be doing and have to do. Is there more that we can do? Definitely. But just in the last 20 years, the system has greatly improved around helping victims and helping families go through the criminal court system.
So I'll just add, I'm on the Public and Behavioral Health Committee, and this year we had a large number of bills that came, and we heard a lot of testimony from families who are in the child welfare system, who are in the dependency and neglect system, and who are in the custody battle system. And what we concluded was there's a lot of piecemeal legislation that's being asked for, and we don't, it appears that we have some really big systemic problems. So some of those bills passed, some of them didn't, but the testimony was incredibly heartbreaking. I mean, the staffer, the nonpartisan staffer for the Public and Behavioral Health Committee had to double up or triple up her Kleenex budget because we were in tears on a regular basis listening to these stories. And at the end of that, the chair of that committee and the vice chair and myself decided we have to look at that over the interim. And so there is a child welfare interim committee happening right now, and they are looking at where are there some systemic failures in these systems that are really harming our kids and our families, the adults and the kids. So hopefully they're going to come up with some good ideas.
The only other thing I want to add, if I can, Robin, is this is an issue that's important to you. I would encourage you to look at the website for Boulder, Voices for Children. They're always looking for volunteers. And if kids are going through the family court system, they can have a volunteer advocate assigned to them by Voices for Children. Last year, if I recall, there were around 270 kids. All of them had a volunteer CASA, a court-appointed special advocate, alongside them because of Boulder Voices for Children. They're all volunteers. They go through training program and they're able to help kids go through what is an incredibly difficult process.
Okay, you addressed earlier, Dee, already some percentages of people who are incarcerated who have mental health, but this question asks, what percent of arrests are related to behavioral health, and how can we get more mental health responders consistently on all 911 calls?
in terms of the percentage of people coming into the justice system that have behavioral health issues, the easy answer, and I don't say it lightly, is too many. At least 50%. And I say that number because when I look at the jail population having over 50% of mental health disorders, and the prison data that I shared with you earlier, it's well over 50%. If you took substance abuse and mental health disorders out of the equation, you would cut our workload and law enforcement's workload by more than half. It's such a driving force to issues in those lives of those people who are suffering, but also in terms of community safety and well-being. So I would say it's over 50%. And the second question,
Co-responding program, more than for long run.
so long run, no, but long run actually is a good example of this, but Boulder PD, Sheriff's Office, and most of the agencies in Boulder County, we have 9 law enforcement agencies in Boulder County, have enthusiastically embraced and led the effort to have co-responders, mental health professionals going out with police officers in response to a mental health crisis. And if you talk to Chief Satter after, and he's an outstanding public servant, he would share with you that the toughest issue they have for co-responders is the overnight shifts. They have challenges, and it makes sense, right? You have someone who goes to school, become a therapist or a counselor, we're asking them to be there at a time of crisis. All too often, that's 2 a.m., that's 3 a.m. So it's the overnight shifts where law enforcement struggles to fill those. We need to make sure they have the resources and support of the state and at the local level to hire really equipped, trained people. But Longmont PD, Boulder PD, others have co-responder programs up and running, and they're making a significant and positive difference in the community.
Let me just add a point. Summit County introduced a co-responder program. The first year they had it, it cut their use of force in half. Monte Vista in the San Luis Valley did the active bystander law enforcement training, which was about supporting de-escalation and more emotional awareness. That cut their use of force in half. Responsible policing adopts these strategies and it builds trust in the communities. It is really impressive how this county has embraced these reforms, but I'll tell you, if you look around the whole state of Colorado, we got a lot of work to do to follow up on this ideal of getting co-responders everywhere.
Yeah, I'll just add that the importance of that, so I think many of you probably read about Christian Glass, who was a young man who was having a mental health crisis in Clear Creek County, which is part of my district. And they went out there with a lot of police and nobody else, and they didn't know how to handle that situation. And they didn't have good guidance, and they didn't have the patience that was required, and they ended up killing that young man. And that's the human toll for that family, for the officers on the scene, and for all of our community. And also, the family sued, and I feel like rightly so. And they sued all the different agencies that were involved, and that cost the people of Colorado $19 million. So that county had resisted implementing a co-responder program, even though there had been problems in the past. And a grand jury recommended from a previous case that they implement a co-responder program, and their sheriff said, I don't know, those people would just be sitting around doing nothing. And then a year later, this young man is dead. And so that's the kind of change we need. We need to really convince all of law enforcement, because yes, in Boulder we're doing well, but a lot of other places aren't, and there's a money cost, and then there is the human toll.
Okay, thank you. We're coming up on 6:55, and so we're going to wrap up the question portion of the evening. And I'm sorry we didn't get to everything. I have still a whole other page and more of these. Some of these have pretty specific situations, so please talk to us afterwards. There's staff from all 3 offices here. We'll be happy to try to help. And again, I wanted to say that the live stream will be available, and we need to be out of the library by 7:30. So, okay, so
uncomfortable question I wanted to answer, so I'll try to do both. You all are engaged citizens, and I am so appreciative. I have seen Boulder County, and the level of engagement, commitment, and real drive to justice here is a benefit to our whole state. The work you're doing, co-responder programs, more detox capacity, more trauma-informed work in the schools, needs to be a model for our state. We have a lot of work to do. And rather than be deflated by the amount of work, I would say there's a concept that comes from my religious tradition, which is you're not responsible for repairing the world by yourself, right? If you look at the enormity of the task, it's easy to say, oh my God, we're in such a deep hole. Don't do that. Instead say, I'm not free to desist from doing my part. Every single person in this room has a part to play to meet this word gets overused, but I'll use it here, existential challenge. The amount of work that we as a society have to do to decrease the number of people who are incarcerated because they're not getting behavioral health, to cut down the recidivism rate because we don't have substance abuse treatment for people, to help people who are suffering because we don't have enough trauma-informed educators, and so on. That is an enormous task. Don't think any of you have to do all of it. Instead, each of you think about, as a citizen, as an engaged person, as someone committed to good public policy, what can you take on? And you heard some specific things like you can be an advisor to young people or families in the criminal justice system who are reeling from trauma. If you've been a victim of crime before, you can be there as a victim advocate. You can work with your schools to develop better practices in the schools. You can find ways to support the law enforcement and so on. There's a lot of opportunities, so I guess my answer is, you said, what can each of us do? Is that the question? Whatever works for you, do something. And don't be despondent. Be inspired to do something that will make a difference and help save and improve lives.
We didn't rehearse or anything. I really think that's the answer. You all have to be with us in the solution. And I know for us, when we're working on legislation, we want to hear from you. We want to know what your good ideas are. And we also want to hear from you about the things that you are unhappy with. And it's nice if people can frame that in, I have a solution. I'd love to at least get you to listen to that. And we have not 100% perfect record, but we're here to listen to your good ideas and to make the changes that are needed. And we need to hear from you, and we need you to hold our feet to the fire. And we need you to not be happy with good enough, but to keep pushing us to do better, because that's what we're here to do. We're here to do the best we can do. And it doesn't happen overnight. It's incremental. It's painfully incremental, the work we do. But every now and then we get a big win, and that's because you all have pushed us to do that. And then if this is my last time to talk, I want to just put out a special thank you to Robin Noble, who orchestrated this. And also to Michael's staff and to Phil's staff and to Amy, who's back there in the control booth, kind of like the Wizard of Oz, who works here for the library and has done a whole bunch of work with us to make this thing happen. So, thank you.
So the question of what can we do, in some ways, looking at all of you here and those that are watching online, I'm reminded of the old George Carlin joke, where he says, people who show up for a motivational seminar actually don't need to be there, they were motivated. But what I would say is a couple things. First, recognizing that we're living through and working through a transformational time in our country, including the justice system. I don't think there's anybody who says, let's go back to the way it was done 30 years ago. It was perfect. No one here feels that way. to you. And I am so excited to be district attorney and honored to be DA during this transformation time. Because I just see the opportunity and the obligation for us to make things better. Not to go backwards, but to make things better. And around behavioral health issues, these are complex problems. So I really appreciate each and every one of you and those online sending us all these questions. We got a ton of questions. And giving up your time to be with us tonight and joining us however you can, however you're able in the fight to make things better. Since our time is up, I do want to stress, and I know Phil and Judy feel the same way, I'm honored to be a public servant. I take that term literally. So if you ever want to meet with me, talk with me, I will always respond, every time. So just reach out and we'll sit down and talk. So if we didn't get your questions